but they followed, I think it was 300 Finnish men over a 25-year span, and they tracked how many times a week they did the sauna. And in the group that did sauna therapy 4 times a week or more, there was a 66% reduction in the risk of Alzheimer's and dementia.
Wow.
There is no drug or any treatment I'm aware of that is that effective. And if you think about it from a scientific standpoint, it makes sense because of the detoxification effect of saunas.
Welcome to the Fountain of Vitality podcast. I'm your host, LaMont Leavitt. In a world overflowing with noise, confusion, and distraction, we're here to cut through the clutter and explore bold, unique paths to a longer, healthier, and more vibrant life. Through candid conversations with business leaders, wellness experts, industry pioneers, and innovators, we'll uncover insights to help you discover your own personalized, unique approach to thriving. Tune in, trust the compass of wisdom within, and find your fountain of vitality. Hello, and welcome to the Fountain of Vitality podcast. I'm LaMont Leavitt, your host, and today we have with us Dr. Sean Altman, and he is a doctor of orthopedic functional medicine. Thank you for joining us.
Thank you for having me.
It's great to have you here. I've had friends, myself included, where there's times when you don't want to be in pain, and you want to look at all the options to avoid the pain and have a good quality life. Love to have you share with us some of the things you've learned over the years as to what all the options might be out there.
Absolutely. Yeah, I'll just start off by talking about the concept of what I've started to refer to as orthopedic functional medicine. So basically that's applying the concept of functional medicine, which is looking for the root cause, to the orthopedic world. So many people go into orthopedic offices with knee pain, hip pain, lower back pain, and they're almost kind of dismissed with the statement, "Oh, you have arthritis. Oh, you need a joint replacement. You need this." But no one's really digging into the why. Why is that person experiencing pain in that particular joint? Especially when you consider that there are people with the exact same amount of arthritis that don't have pain, or even more arthritis that don't have pain. So there's often a lot more to that problem. And I've spent my career really trying to understand the why. And then when you understand why something is hurting, why a joint is a problem, then you're best equipped to go with the how. How do we treat that? How do we address that? And I've learned along the way that there are many different very powerful self-healing modalities that can be used to do just that, to get the body to repair itself, to correct things like muscle imbalances, ligament tears, muscle strains, cartilage damage. And I'm not even talking about, things like regenerating cartilage, like stem cells. I'm just talking about healing the existing tissues and how much of a profound effect that can have. So, I think that as we all, age and we get our various aches and pains, it's important that we do kind of a medical audit of our team, and ask these questions of okay, you're telling me there's arthritis in my knee. Why is that bothering me? What's going on? And if the providers you're working with are not giving you more detailed information, they're not able to really help you find a solution other than surgery. It's probably better to get additional opinions and, be your own advocate, try to get to an answer that helps, get you where you need to be.
I think it's important for patients to, like you say, be their own advocate and be they know their body more than anyone else, and look at what works, figure out what works. Is it contributed by your diet or what you're doing physically or not doing? So yeah, absolutely. If you would share with us some, maybe a success story or two of people that have tried some new things that have worked for you as you've worked with different people.
Absolutely. So this year I've had some pretty remarkable stories. I had the this patient that came to see me. It was the third time that he tore his Achilles tendon. He had had
Wow.
two prior surgeries. He had met with a couple of surgeons. They were recommending an Achilles tendon transplant, which is really like an experimental procedure. So they wanted to take an Achilles tendon from a cadaver, transplant it in there, and obviously that would have been a very long recovery.
Sure.
And we were able to use some of my treatment methods, this ultrasound guided technique called ultrasound guided needle electrolysis. So that's delivering electrical current to the target tissue to stimulate healing. And that combined with laser therapy and then a loading program to strengthen the tendon, we were able to get him to heal the tear on his own. And then within 12 weeks, so within 3 months, he was running in a 5K. And
Wow.
then I'm happy to report I just saw him recently for a 1 year follow up just to see how he's been doing. Since then, he's run 2 half marathons with his son and, feels like he could conquer the world. And, this is 1 year later. Now, if he had had the surgery, now 1 year after an Achilles surgery, he probably would be just starting to run, or maybe doing a
Yeah.
little bit of running. And in the meantime, we had him heal his own body, and he was able to run multiple races, play with his grandkids, do all of these things by just allowing the body to heal itself. And I see this time and again that if you're able to get the body to catalyze the healing process, it's going to be faster, and in a lot of cases, the outcome is going to be better. I also experienced that with a really interesting patient of mine with a complete ACL tear. This is a gentleman who plays college soccer locally. He tore his ACL at the end of his junior season. He came to see me.
In college? Was this in college?
Yeah, in college. Yep.
Yeah.
He came to see me because he actually had torn his other ACL in high school, and it cut away most of his freshman year, and he also had a bad experience with the surgery, and he desperately, desperately wanted to be able to play in his senior season, before he graduated, and we were able to get him up and going, complete ACL healing with a bracing protocol and energy modalities within 6 months. And he's playing now and, running his heart out at practice. And, it's just been a fantastic story to show what the body can do. And not just kids. This is, the gentleman I mentioned earlier with the Achilles issue. He's in his late 60s. This is not at any age with the right treatment, the right health, minded attitude, we can run, we can thrive, we can do all the things we want.
So, with all those modalities that you can do, what does the patient have to do to be for their diet or vitamins, or what are the things that they can do to be proactive to accelerate the healing process that they can control?
Absolutely. So, we look into potential things, lifestyle changes that can optimize their body's ability to heal. The number one thing I look at right off the bat is sleep quality. So if someone doesn't have good quality sleep, they're not resting, they're not recharging, and they're not healing as quickly as they should. And that's really from any type of healing. So that's healing from an injury, but also healing from an infection or illness. So we need good quality sleep, and then we look at other things like diet. Is their diet too inflammatory? Are there things about their lifestyle that can be improved? Even like stress or anxiety can play a role. But I'm very much about meeting the person where they're at. So our goal is, as I like to say, function, not perfection. So if we can make these little changes, improve, the way your overall lifestyle is working, it can make a big difference in terms of your healing capacity. And there's room for error. You don't have to have a perfect lifestyle to succeed, but these little improvements can certainly make a difference. And then, layering in things like peptides and red light therapy and other types of home modalities can also support that healing process as well.
Well, so the patient, thank that's helpful. The patient needs to do all they can do. It's kind of a teamwork approach, really. That's
Absolutely.
patients
No,
got to
it's
do what they need to do. Now, as the doctor, if you wouldn't mind going into the nuts and bolts a little bit deeper with some of these new modalities and therapies that you're finding success with, I'm sure for some of our listeners, they like to know a little bit deeper
Yeah,
on some of that stuff.
absolutely. So I'll go over just, broad strokes, some of the basic modalities I use. One of them is laser therapy. Therapeutic laser therapy, you'll see it also as like photobiomodulation, has an effect on the mitochondrial activity in the body. It's a biostimulator, so it increases energy and metabolism in an area, and that's really vital in terms of any healing process. So it can help the process begin, but then it can also continue to encourage the process along the way. That's something that has been pretty remarkable. We see in the orthobiologics world when laser is combined with PRP or stem cells, those patients typically heal 2 to 3 times as fast, and the outcomes become much more likely to be successful. And then, it can also be used on other things like fractures. I've used the laser on non-healing fractures, and it's been able to get enough energy to the fracture site to get it to heal on its own.
Oh, great.
Um, Another thing that many of you are probably hearing about now more and more on social media is shockwave therapy. So shockwave therapy is acoustic therapy. It's basically using sound waves to mechanically disrupt the tissue in the area. It provides energy as a stimulus. It increases blood flow. The mechanical nature of the sound waves breaks up muscle tension. It's become very famous for it is probably the best treatment out there for something like, say, plantar fasciitis.
Oh,
Um,
really? I didn't.
it has this ability to break up the adhesions and the tightness in the plantar fascia while decreasing inflammation. It's really the only modality that can do that can mechanically break up tissue but not irritate it. Plantar fascia especially is one of these very irritable structures where people will try to roll it on a tennis ball or a water bottle, and then they'll have an inflammatory response. It'll just flare it up. So it's like one of those things that's just kind of hard to get to. And then one of the other things that I use quite a bit is PEMF, pulsed electromagnetic field
Yeah.
therapy. PEMF has been around for a really long time. It actually dates back to Nikola Tesla running, electric current through copper wire to create an electromagnet. And we know that these electromagnetic fields, they pass all the way through the body. So we can get into structures that develop inflammation, like bone. People with more advanced arthritis will develop things like bone marrow edema, which is basically swelling in the bone. Where someone will say, "I have pain." It's like in the joint, like it's deep. That's the type of pain they're describing. And PEMF is a phenomenal modality to get into those deeper bony structures non-invasively, not with an injection, not with a surgery, but just with a magnetic wave that passes through your body painlessly.
I've
Um,
seen PEMF. I've seen a lot of different machines over the years.
yeah.
What's the most current ones you feel good about as far as in your practice?
So I won't get into any like brand specifics because I don't want
Okay.
to. But what I will say is that if you do your research, the prolonged benefits really come with higher intensity PEMF. So there are home-based units that you can use that will have like short-lived benefit, 4 to 6 hours of improved circulation and decreased pain, but then it wears off. If you really want to catalyze a more lasting change that lasts, like, say, several days or a week, it needs to be typically above, like, it needs to be 1,000 Gauss or higher.
Okay.
Um, you know, and certainly it has to be reputable brand and safe and all of that. But I apply science to all of these things that I do. And the emerging evidence in terms of these higher intensity PMF machines is pretty remarkable. There's a study this is obviously like a pilot study that just came out earlier this year from a colleague of mine out of Greece, where they actually used high intensity PEMF therapy as a treatment for breast cancer.
I didn't know that.
And they found that within 5 days of treatment, they were doing treatment twice a day for 30 minutes. So it's basically 60 minutes of treatment for 5 days. There was already evidence of cancer cell destruction and the reversal of what we call cellular senescence, which is basically what happens with cancer cells. They become like lazy cells. So it was already starting to treat it. And the emphasis here with that particular example is where a misconception comes, is that the PEMF didn't attack the cells. It did, like, the magnetic field didn't do the work, the body did the work. But because it provided such a tremendous amount of energy to the cells in that person's body, it had the resources to attack those cancer cells, to fight back. And that's how I view a lot of these energy modalities, is really like trying to arm the person's body with the appropriate resources so that it can move beyond an obstacle. It can get beyond an injury or a problem that it's experiencing.
Is there anything in your work that you do with AI as it relates to figuring out where the body is, as to get to the root of the actual problem and not just the symptom?
So I don't use AI for diagnostics, but I have certainly used it as part of my research process,
Okay.
in terms of refining protocols, combining boatloads of data to like come up with the more precise parameters, understanding that high intensity, over the 100 studies that I had it help me summarize and review, that it was ultimately more beneficial than medium or low intensity. So I think it's excellent as a research tool, as a resource, but the diagnostic part of it is it just can't be there, because there's a level of decision making and experience that's needed that you can't teach an AI module. There was something I was reading several months ago. They were testing a particular medical AI system and its ability to read X-rays. So it was just like a very simple, like, femur fracture X-ray, which is like the thigh bone, and they fed 10 different prompts into the AI with the identical set of images, and then the reports that were generated had 10 completely different outcomes in terms of what it was seeing and what was analyzed. And of those reports, only 4 of the 10 diagnosed the fracture. 6 of them missed it.
Oh, wow.
So
it's interesting.
It shows you that, because AI is essentially based around trying to please the user, trying to give you the answer you want, there's going to be this inherent bias. But if you're using AI to assemble material, if you're using it to help you analyze data, that is not going to have bias. That's more, just number computations. And, that's fantastic, because that can help us, assemble, and analyze data much quicker, and ultimately, probably come up with discoveries that might take, decades for us to achieve otherwise.
Yeah. AI definitely has its place. So we've found it's been fun to watch the evolution of it over the last several years, and trying to keep up can be challenging, and it keeps making improvements. And it's interesting to see the different vendors leapfrogging each other with features and enhancements and less hallucinations. But it's an exciting time to be alive, for sure.
It is, absolutely. The science, the technology, we're starting to have the tools to advance our treatments, and even to validate these treatments that we are doing, like to have a PEMF study that shows that significant of an effect, or leaning a little more, like, even more into the energy medicine realm. There are emerging studies now where they're able to quantify and qualify energy coming out of what we call like energy healers. So people who do Reiki, craniosacral therapy, like manual work where they manipulate.
They can actually measure.
They can actually measure the change in energy. They can measure that it's moving from, the provider to the patient, and basically prove that something is happening. It's not, woo or voodoo or,
Yeah.
whatever, people have said in the past. And I think that's a really important step because, there are people who like genuinely believe in this stuff and who have clearly experienced benefit. But science hasn't always been able to explain it. And, with science, when we can't explain something, it's very natural to be critical of it. Like I don't think being critical is a bad thing. It's goes back to what we talked about earlier about, being an advocate and being curious, which is healthy. Like I've always been a fan of discourse. I feel like arguing, discussing, analyzing things, helps you better understand the topic and also helps you better understand, what you might be missing.
What other, as long as we're on energy, what other energy modalities have you seen or people experimenting with? We talked about PEMF and the other, but what other ones are you aware of, or evolutions that you're seeing?
Sure. So there's one in particular that I use a lot in my practice. It's called frequency specific microcurrent. So it's a low level of electrical current, essentially 1,000 times micro, 1,000 times less powerful than traditional electrical stimulation. And it's used really as a like neuro and biofeedback tool. So it utilizes different frequencies to communicate, with the cells in the body and to try to encourage, things like increase blood flow or decrease inflammation, altered pain signals, to try to reinforce, or recalibrate how our systems work. And I find that really like things geared toward that retraining, recalibration, that's really the best way to like get our bodies back into that homeostasis, state.
Okay.
So, you know, one of the big things that has come out, lately is talk about the vagus nerve, which regulates the parasympathetic nervous system. In fact, they're now like starting to do vagal nerve stimulator like implants for things like rheumatoid arthritis, where continued activation of that nerve calms the nervous system and reduces that autoimmune response. But what the FSM does that's a little different than those stimulators is it helps the body to recalibrate and retrain that system. And at a certain point, it's no longer needed. Like the body just, it finds that new set point and it starts to work more on its own. And it may not work on something like, say, rheumatoid arthritis, because that's a genetic issue, but it will work on other disorders, other issues, where the body is able to get the appropriate resources in place. So that tends to be my emphasis with a lot of these modalities is retraining and feedback. It's just refining the way that the body works, which is, I know, quite kind of an abstract concept, but if you kind of apply this to like something like a skill, like skiing or throwing a baseball or riding a bike, there are ways to retrain and improve the way that you do that particular activity to optimize it, to go from throwing a baseball 70 miles an hour to 95 miles per hour, to being able, going from bicycling with training wheels to no training wheels, to cycling and going, really fast and being able to handle, challenging terrain. And that all has to do with this retraining, recalibrating, where the body is clearly an active participant.
That's cool. So we've talked about energy, healing. We've talked about sound. We haven't covered light too much. A lot of times you hear the word red light therapy, and
Mm-hmm.
and that can be used very loosely,
Yes,
with all the different spectrums. Would love to have your thoughts on light.
absolutely. So, I use laser therapy, for therapeutic laser. So that's infrared. So that's invisible. That penetrates deep into joints, into tissues to help stimulate, deeper healing, or to, target, say, like nerves. But then there are other wavelengths of light and other forms of light, like, red light therapy, which can be used more superficially for skin and fascia. And then, we can even use like phototherapy, which is various colors of light to encourage certain brain waves and, to create an additional form of feedback with the body. There's even this device now, this company I work with called Higher Dose. They make a number of therapeutic products. And one of their products is a phototherapy shower head.
Oh,
So,
really?
so the shower head emits different colors of light, and you can use it, to stimulate yourself. So, like, say you're doing a morning shower and you want to wake up and, turn on more stimulating brain waves. It can be refreshing in that way, or you can even use it, in a more calming setting to like sort of calm the body down, encourage, the more
A
calm
day
brain
in.
activity that gets you ready for sleep.
Huh. Huh. So how does it work in the shower head? Is it like a battery up in there, or
Yeah, and
does?
they're LED lights that are, controlled with a remote, and yeah,
Huh.
it's pretty remarkable.
That's cool.
And then on along the light treatment spectrum, one of the other things I'm a huge fan of is infrared saunas. Because the infrared light is, inductive, so it gets deeper than say like a traditional sauna, and that can be really beneficial health wise for detoxification, as well as just overall health in general. Saunas in general, we have found huge longevity benefits with saunas, in terms of long-term benefit. So there's this study, out of Finland. Finland is for those of you who don't know it, Finland is the sauna capital of the world.
I didn't know
Um,
that.
there are enough saunas in Finland for every citizen of Finland to be in one sauna at the same time.
Well, that's probably because there's no sun there. So
I guess so, but they followed. Um, I think it was 300 Finnish men over a 25-year span, and they tracked how many times a week they did the sauna. And in the group that did sauna therapy 4 times a week or more, there was a 66% reduction in the risk of Alzheimer's and dementia.
wow.
There is
Wow.
no drug or any treatment I'm aware of that is that effective.
Yeah.
And if you think about it from a scientific standpoint, it makes sense because of the detoxification effect of saunas. It doesn't allow those toxins to make their way to the brain and cause things
Mm.
like oxidative stress and damage that we've associated with the development of those neurologic issues. We obviously would assume additional benefits, like probably their cognitive health would be, additionally better just because of, the system is running cleaner with less, better blood flow and less toxins there. I think having a good detoxification strategy as part of your overall health plan is essential. Like I said earlier, I want to meet my patients where they're at. We can make lifestyle changes. We can try to eat as clean, as healthy as we can. We're not going to have a perfect diet, unless you live on a farm. That's pretty, pretty challenging. And then around us, there are other like toxic elements like mold and heavy metals and electromagnetic fields that, we don't always have control over. So we can do our best to protect ourselves, to minimize exposure to those elements. But then, you also want to defend yourself, and take care of yourself by having these detoxification and, health benefit strategies in place that, will essentially offset the environmental stresses that you deal with on a daily basis.
Okay, so with red light therapy, you mentioned these guys that did well or less Alzheimer's and dementia were using it 4 times, a week. Do you have any rough feel for are those like 10 to 30-minute sessions or a full hour every time? Or
About 30 minutes. Yeah. Usually we find that, 30 minutes or more is typically the sweet spot with sauna.
okay.
It doesn't necessarily need to be an hour, but it's typically a minimum of 20 minutes. At 20 minutes, you really start to, have a deeper sweat. There's more, that's the point where people really start to feel it,
Yeah.
which is when some people start to want to get out. Um, But for people in the audience who've done sauna consistently, I'm sure they'll attest to the fact that once you start doing it a little more often, and you start to realize the benefit it has on your health and how much better you feel, you realize that it's not so bad to stay in there. Like there's clearly a value to it.
Yeah, yeah. A lot more. There's got to be. We have so much chemicals and things in our environment that we're being lambasted with constantly.
Yeah.
It's you got to find ways to fight against that individually. All of us, we all do.
Absolutely. And that's what I like about these tools, these treatments is, it helps you combat it, as it comes. The best thing, proactive, preventative medicine is always better than reactive medicine. So getting at these toxins and these environmental issues now rather than when you get ill or sick from them is always going to be the best strategy.
As an orthopedic functional doctor, how do you work with patients where they kind of want to come in, but they're kind of skittish because they've always done things differently? How do you get them over that mental hump of being willing to try something different?
I think I lead with this educational tone of just really explaining to them why they're dealing with these issues, what is the root behind all of this. And I think for those who are willing to listen, who really do care about their health, they tend to stay engaged. But it's not for everyone. It
Yeah.
depends on the person. There are certainly people out there who don't necessarily want to work to improve their health. They don't want to exercise consistently or eat a healthy diet. They would rather take pain medication, and do things that are, say, not as healthy. And all you can do is lead the horse to water. You can,
Yeah.
I try to provide them with the best information I can, support them in their journey, and then it's really it's up to the patient if they want to take that next step. Because as you said earlier, it's a team effort. I need my patient to be my teammate, and we're gonna do this, work together. But if you don't want to participate, if you don't want to be an active, part of improving your health, if you want to just be passive and on the sidelines, this type of strategy is not going to work as well.
That makes sense. Yeah, it's like playing basketball 5 against 3, or you got to have the whole team there, your whole
That's
team,
right.
and
That's right.
and the patient to be engaged and willing to do all that they can do from their end. So
And when they are engaged, I find that it is affirming and powerful for these patients. With chronic pain, and I've worked with the chronic pain population for more than 15 years, there's this real feeling of like helplessness where you feel like a victim and you feel utterly dependent on the medical system to take care of you.
yeah,
And when you flip the switch and you feel like, oh, wait a second, there are things I can do to help myself. And I can be, I can come off the bench and get into the game, and I can play and help get myself better. It can really, even just psychologically change the script. And, that feeling of having control over your own health is very, it's very powerful. And, it can really become an internal motivator where people are more motivated to eat healthier, to exercise, to live a healthier lifestyle because they realize how much control they have over these things and how much of an effect they can individually have on it.
yeah, that's true. Well, it's been great having you on our call today. Dr. Sean Altman is a fantastic doctor. He's been through the loops on this, and I loved hearing some of those stories you told us about how people with their Achilles tendons are back in the saddle, whether they're in their 60s or they're in college. Don't think you're too old to not have pain anymore. Don't think that you're too old to keep trying to find another solution. If one of our listeners want to get a hold of you, where could they reach you?
So the best place to look is my website, drshawnaltman.com. You can also find me on social media. I'm on Facebook, Instagram, and LinkedIn under Dr. Sean Altman for networking purposes. And as I said earlier, my goal is to empower. My goal is to help people learn about their own health and get answers they need and to become a part of the process. So if that sounds like you, if you're motivated to help get yourself better and you need a guide or even just a little bit of advice, I'm more than happy to help you out.
Thanks a lot, Doc. Appreciate having you on the call today. And good luck to you in your practice and
Thank you.
helping changing people's lives one at a time. Thanks. Thank you for tuning in to the Fountain of Vitality podcast. Head to fountainofvitality.com for more episodes, insights, and resources. Remember, your health is yours to own. Take charge, focus on what you can control, and keep exploring what works for you. Always be your best self, lift others, and trust the compass of wisdom. Until next time, stay vibrant and take care.